Hi, today I'm here with Sid Siddiqui with the Spine Center. Sid, how are you doing?
I am good. How are you?
Doing great. Listen, I just had a chance to tour your fine facility here, but before we get into the facility, tell me a little bit of what's it like to be you're a surgeon, right? You're an orthopedic surgeon that specializes in back surgery, is that correct?
Yes, correct. Actually, the whole spine, so be it cervical, which is the neck, or lumbar, which is the lower back. But basically, I'm an orthopedic spine surgeon, and I limit my practice to just the spine, so I don't do the shoulders, hips, and knees and all that anymore. And I've been in Houston about 4 years, and I started with an orthopedic group for the first year, and then I decided to start the Spine Center and focus just on spine problems only.
Well, I'll tell you what, I think everyone in America has a back problem. I know most people that I know have had a back injury or problem at some time. Is a back problem, is it mainly hereditary or is it from injury? What seems to be the number one reason for a back problem?
Yes, it can be either. A lot of the patients I see are from some sort of injury, either they were hurt at work or playing around in their yard or maybe an automobile accident. But a lot of people that I see also just have a degenerative condition, which can be either from old age or hereditary, or sometimes for no reason, and it usually manifests itself sometimes in their 30s, usually in their 40s or 50s. And, you know, back pain or neck pain, you may have a disc which is abnormal on your MRI with a tear or herniation.
When do you prescribe for a patient that it's time for surgery? Is it for everyone, or you make that diagnosis, is that correct?
Yeah, no, it's certainly not for everybody. I mean, for people to be considered for surgery, usually they've had symptoms that have been chronic for at least 6 weeks, more commonly even 6 months or years. The only time we recommend surgery immediately is if they've got something such as spinal cord compression or severe nerve compression, or if they're admitted to the hospital and their pain is so severe that they're on morphine. So those are very few and far between. Usually it's a fairly elective situation. And if they have not been to the chiropractor or for physical therapy or injections, we often suggest that first. Or maybe even just losing weight or taking some medication. So people I recommend surgery to usually have failed all of those, what we call non-operative measures.
I see. And one of the things I know that you're known for, and that's one of the reasons I want to come by and visit with you today, is this invasive versus traditional surgery.
Yes, less invasive surgery is a more modern technique where you can really do the same operation as traditional surgery, which involves larger incisions, more blood loss, longer hospital stay, more pain and morbidity afterwards. And now we're using some techniques that we have had recently. We're able to do the same procedure through a smaller incision, which means all the opposite things, which is a smaller scar, less pain, less usage of pain medications, less blood loss, and able to get up and around quicker, and usually able to return to your job or occupation a lot quicker.
Well that makes your employer happy, and I'm sure your wife or your spouse are able to get back up in duty again. And do you take insurance? Is that one of your main?
We take everything: private insurance, workers' compensation, Medicare, pretty much everything.
And you work with different. You work with physical therapists. You work with chiropractors, other doctors. I understand you get most of your business from referral.
Yeah, pretty much. I would say 2/3 to 3/4 of our patients are referred. Some find us from friends and relatives, you know, previous patients, word of mouth. Some from the internet, but it's mostly referred.
Right. Well, I have to tell you, after taking that wonderful tour with you and your people, tell me about this center here at Champions. It's like it's a medical center under one roof.
Yeah, well, this is our main office. The idea here was to have a one-stop shop and have all the care delivered in one roof. So from diagnostics, be it X-ray, MRI, CT scan, to just having your physical history and examination done by myself. And then if you need any other tests, such as EMGs, or if you need referral to a physiatrist or physical therapy, or if you need just blood tests or EKG, it's all done.
Physiatrist, what's a physiatrist?
Physiatrist is somebody who's done a pain management rehabilitation fellowship or residency, and they prescribe physical therapy. They also are able to do injections, like epidural steroid injections. We work with a lot of other physicians, such as pain management physicians, rehabilitation specialists, physical therapy locations, such as you mentioned, chiropractors, you know, whatever the patient needs to get them better.
And coming under one roof, I can have the convenience of not having to run to one of the clinics or having blood drawn or going to another place to get an EKG. That can be done here under one roof.
Yes, and it saves a lot of time. I mean, when you're a spine patient, whether you have a neck problem or back problem, the last thing you want to do is go running around and then wait 2 weeks for an appointment to get the next step done, and then it's 3-4 months before they're even getting treated for anything. We want to try to shortcut all that and get the patient evaluated and get them treated so they start to feel better quicker.
Great. Well, I understand good news for us in the Clear Lake area. Dr. Siddiqui and his group is opening an office there, possibly in Pine Lock area. Is that correct?
Yes, that's correct. And we're looking forward to working with some of the area doctors and servicing that community with what we have to offer. That
is just excellent. We welcome you to the Clear Lake area. It's a pleasure meeting with you, Dr. Siddiqui, and we look forward to working with you in the future.
Thank you. Thanks,
Dr. Siddiqui, the Spine Center.